My goodness. Hi, everyone. It's been a while since we've been together. Hi, everyone. I'm Rundy Murphy, epidemiologist and director of disease surveillance here at the Mobile County Health Department in our downtown Keeler location. It was, I think, exactly 1 month ago today that we said we were going to stop doing Facebook Live updates on the COVID-19 pandemic in Mobile County, and we would come back to you when there was, new information or if things changed. And here we are on December 1st with some important information to share and a couple of questions to answer. You've probably all seen in the news. Hey, Mark, would you get something off my printer? Would you get something off my printer in Josie's office for me? On November 24th, scientists in South Africa announced that they had identified a new variant of COVID-19 that the WHO has labeled Omicron. Its scientific name is B.1.529, but to make things simpler, WHO has named it Omicron. And I believe that announcement came on the, like I said, on the 24th of, yeah, these are not the ones, Mark, sorry, that's okay. On the 24th of November. And so let's talk a little bit about the numbers, talk about Omicron, what we know and what we don't know, and then speak a little bit about some work done at FDA yesterday. So the numbers of COVID-19 cases in Mobile County residents continue to be very low. That is the great news. We're still seeing a low number of cases, though our case rate per 100,000 people is still in the moderate range. So overall, we still are at a moderate level of disease transmission with an average case rate of 22.5 cases per 100,000 people on any given day. And again, that's what we call a moving average. Our percent positive, this is at the state level. When they calculate it, they have access to a little bit different data than we do. They calculate it at 4%. So as far as the state health department website is showing the our community transmission level is still at moderate. Our hospitalizations are beginning to creep up a little bit. This has me really concerned. We have seen over the last couple of days 22 people in the hospital. The day before that, the 23 people in the hospital had been down below 15 or so, but over the past 2 weeks, a week ago, we approached 20 in the hospital on any given day. Then it went down the week of the holiday. And then when the holiday ended, we've seen a rise in the number of people hospitalized on any given day. So we're keeping a very close eye on that. Our report today, we're showing an additional 2 deaths added to our count. Both of those deaths added occurred in November, but were just reported earlier in November. But were just reported to us. So again, we are still seeing a small number of deaths each week. We're seeing a slight increase in the number of hospitalizations because of COVID. The case count is staying low. The percent positive test is staying low. So those are all good news. Those things are all good. Another thing that we're seeing creep up a little bit, and it's hard to know, there's kind of a mixing of effect of COVID-like illness and influenza-like illness in emergency departments. So in our emergency departments, we're seeing a slight uptick in the number of people, the percent of people attending emergency departments for COVID-like illness and for influenza-like illness. It's still below the threshold of concern for ILI, but it is creeping up, getting up to, creeping up on that 3% mark. So that is going up some. Again, right now, it seems to be COVID-like illness and influenza-like illness, sort of both of those creeping up, but we will continue to keep an eye on the percentage of emergency department visits that are occurring for both COVID-like illness and influenza-like illness. Most of the increase in influenza-like illness is occurring in children. So whereas for adults, We see the percent of emergency department visits in adults that are for ILI are down, less than 4%, less our sort of threshold of concern, which is around 3.4%. But in children, it seems to be quite high. So those of you that had kids home for the holidays, you probably are more aware than I that kids have the crud and it is going around. So please remember, wash your hands, keep your distance, wear a mask if you aren't vaccinated. That will protect you from COVID and also from ILI transmission. So let's see. So on to talking a little bit about Omicron. So as I mentioned, on the 24th, the South African government announced that the Omicron variant, or B.1.1.529, was reported to WHO by South Africa. The variant has a large number of mutations, most of them in the spike protein, but some of them in the ACE2 receptor, and this large number of variants is concerning. There are some good things about Omicron. One is it has a very characteristic, what we call an S target, an S gene target failure. That makes it fairly easy to detect on PCR machines. If you have been keeping track, the Alpha variant had what we call the S gene target failure, which made it easier to detect on traditional PCR machines. And the Omicron variant has that same S gene target failure when run on some traditional PCR machines. So that may make it a little bit easier for us to conduct surveillance. And going back and looking at trends in surveillance for S gene target failure specimens has partly got the whole world up in arms about this Omicron variant, that the rates of increase have really occurred at a much greater pace than other variants, and that this variant may have a growth advantage, it may have a transmission advantage, but again, we're so early in what we know about the variant. There's more that we don't know than we do know. It has been classified as a variant of concern. The number of countries where it is detected is changing by the hour. So the South African scientists have a website. They produce a surveillance report that you can look at if you're keeping track. But a couple days ago, it was identified in Canada, and then today was announced that the first confirmed case of Omicron variant was detected in the United States, was reported by the California and San Francisco Departments of Public Health, was in an individual in California, was a traveler who returned from South Africa on November 22nd. The individual was fully vaccinated, had finished their second dose in August, and had mild symptoms that are improving. The traveler recognized that there might be the potential for COVID infection, and the traveler self-isolated, and all of the close contacts have been contacted and all have tested negative and are being monitored in quarantine with continuing testing. So again, the sequencing was done at UC San Francisco and confirmed at CDC as being consistent with the Omicron variant. This will be the first confirmed case of COVID-19 caused by Omicron in the United States. Again, announced today, about 1 o'clock today, December 1st. I was actually doing an interview on tape about the variants being identified around the world, and the email popped up that the first identification on U.S. soil was announced. So again, there's not a lot that we know about the Omicron variant. We're still trying, I say we, I mean the scientific community, still working to determine transmissibility, to determine risk of infection, to determine severity of disease, to determine if our diagnostic test will detect it, to determine if our vaccines are effective against providing immunity to the variant, and also determining to see if the current therapies that are authorized or approved for COVID treatment are effective for people who are infected with Omicron. So again, all of these things will be heavily studied over the next couple of weeks. And as we learn more about the data and the science, the facts around Omicron and how it behaves in humans, we will certainly let you know. But please be patient and let's try, um, you know, not to speculate much or to really make too many decisions based on the threat, but let's try to be patient and let the data and science develop and be shared with us so that we can make the best decisions. I think right now what everyone in the scientific and medical community agrees on is that vaccination and getting boosters is the best thing that you can do right now to protect yourself from COVID-19 and likely protect yourself from variants, at least have some protection from COVID-19 variants. The amount of that protection is still a little bit, every time a new variant pops up, we're going to be in this situation. We, will suspect that there will be some immunity conferred for other variants, even though you were vaccinated on a vaccine that was developed against a parent strain that really is no longer circulating. But the extent of that immunity will have to be determined. So the more we can do to stop transmission, the better off we are. And the primary way of reducing, preventing transmission, slowing transmission in the community, getting your vaccine, getting a booster if you're due, distance, wear a mask if you're in crowded spaces or among people that you're not sure if they're vaccinated or not, avoid indoor dense gatherings, those things. We have been experiencing a very low level of transmission in Mobile County at this point. It's been quite a more restful holiday season for a lot of us because we're, seeing so very few cases, but we really want to keep it that way. At the health department, we're committed to our mission of promoting, improving, protecting the health of the whole community. So as we learn more, we will share those things with you. It's spreading around the world fast. It's not in Alabama or Mobile yet. And again, it could be several months or maybe never before it gets here. But I think history has shown us that for, when variants start spreading around the world like this, we're not immune. The U.S. became the epicenter for Delta transmission for quite a long time. And so it's probably not realistic to think we're going to be able to keep it out of the United States. So vaccinate and boost. Let's see if there's anything else I wanted to share about that. I don't think so. The other big thing in the news that is maybe slightly shadowed by the announcement of the first case of Omicron in the United States is the fact that yesterday, November 30th, FDA voted, a scientific advisory panel voted on whether or not to recommend that FDA provide emergency use authorization for the Merck antiviral. When the early data came out on the antiviral, this is an oral medication, it looked quite promising that in the preliminary data, it prevented hospitalizations by 50% and no one in that received the treatment died when compared to 8 people in the placebo group. When the full data set was provided, the data didn't look quite as good as that. I think the hospitalization reduction went to around 30% instead of 50%. So that, taken with some concerns about side effects, particularly some potential for birth defects in women who are pregnant who may be affected by the oral medication. There's a lot of discussion. In the end, FDA advisory panel voted 13-10 to recommend that FDA authorize emergency use of this antiviral and set parameters around how it could be used, what age groups, what populations, probably non-pregnant women, that sort of thing. So more to come on that. We were very excited when Merck first applied for FDA authorization for this oral antiviral, because for a lot of people, oral medicines are more appealing than an injectable, whether it be a subcutaneous injectable or an intravenous injectable. treatment. So again, just another tool in the toolbox, but we will wait to see what FDA does with the advice that it has received from the advisory committee on the oral Merck antiviral. So there are a couple of questions. One is, should people be concerned about the Omicron variant as we head into the holiday season with lots of travel? So I think that is a resounding yes. Travel has been suspended. International travel leaving 8 countries in South Africa has been suspended except for U.S. citizens and some, non-citizen family members. I don't know if we will see additional travel restrictions as Omicron pops up in other countries. Certainly in South Africa, it is the dominant strain there, is causing a lot of infections. Only 24 to 25% of those populations are fully vaccinated. So I think that's why there has been this action by the White House to restrict travel from those 8 countries. Also, people returning from those locations in some of our large reports may be screened, may be offered testing, that sort of thing. So yes, for people who don't travel internationally and maybe travel very little domestically, it will be some time before Omicron shows up in Mobile County. If it does, I don't know if you remember when Delta finally made it to Mobile County. We first identified Delta in a traveler that had returned from India. That's where that strain had first been identified. But it did not take long for many travelers, not international travelers, but people just traveling to other parts of the United States where Delta was taking a foothold. Did not take long for Delta to become the dominant strain here in Mobile. So we're just going to have to wait and see. But certainly, if you are traveling domestically or internationally, you should be vaccinated. If you're on public or federal transportation, wearing a mask is required, and there are certain conditions for re-entering the United States if you do travel internationally. So protect yourself and be smart with your behaviors when you're on any type of public transportation. All right, I've already talked about what we know about the Omicron variant, which is not a lot. So stay tuned as the science develops or is revealed on the Omicron variant. All right. Someone else asking that the numbers in Mobile County seem low. Have we seen a trend or bump up of late that might give you some alarm? Yes, I'm keeping a close eye on these hospitalization numbers. Again, last week, at the beginning of last week, they had jumped up to almost 20. And then in the last couple of days, it was above 20 people in the hospital each day. That might seem low, but it is compared to previous days and weeks, it is a fairly large 20 to 25% increase. So I'm going to be keeping a close eye on that. Generally people don't go to the emergency department or to the hospital on Thanksgiving or the day after Thanksgiving or Iron Bowl Saturday. So sometimes people who've maybe been putting things off then will go and seek treatment in EDs and then might end up getting admitted. So hopefully that's what we're seeing. Hopefully it will go back down once we sort of get into the early part of December, but we're keeping a really close eye on it. And then a question about getting booster shots. So someone asking, should you stick with the same product? You can stick with the same product. So if you got Moderna, you can get a Moderna booster. If you got Pfizer, you get Pfizer booster, or you can decide to switch. It's up to you. I've have a report here that there may be a shortage of locations to get a Moderna booster, that there are very few locations, Walgreens and CVS and other, big pharmacies that are providing Moderna, and where can people get a Moderna booster? So at the Mobile County Health Department Clinic, at our new location at 101A, Suite 101A Festival Center, at the corner of Airport and Montlamar. We are there 6 days a week. So usually there's walk-in, no waiting, no cost to you. Come and get your Moderna booster, whether you're in Baldwin County or Washington County or Mobile County, or if you're in Mississippi and you have your card, you can come get your Moderna booster with us. So again, At our location at Festival Center, we have Johnson & Johnson, Moderna, and Pfizer, and we're also giving pediatric Pfizer. So anyone 5 and 11 can get a Pfizer shot, Pfizer series, and a Pfizer booster when you're eligible. And we also carry the Moderna booster. Oh, yeah, Mark's reminding me that we also still do walk-in rapid testing at that location, no charge to you. And again, most people have to wait for a very short period of time, and then you get your results while you wait. So, are there any questions? I'm not sure if we will get back into a regular pattern of providing Facebook Live updates or not. If you have a strong opinion about that, please make a comment and give us some feedback and let us know. Again, we are committed to providing updates when we feel that there is important information to get out there to you with which to make good decisions about protecting the health of yourself and your family, your coworkers, your parishioners, your social club. So again, it's still not too late to get a COVID vaccine that can protect you and can prevent you from getting hospitalized and potentially protect you from death if you do get infected. And also, it's not too late to get a flu shot. You can get both of those at the same time at some locations. So let us know if you have questions. Let us know if you think that we need to have some more regular updates going into the holidays. And if not, if we don't talk to you again, please, everyone, have a safe holiday season. Be smart. Enjoy yourself. Enjoy this low community transmission, moderate, but still lower than we've seen. But be smart when you are out in the community to protect yourself and your family. We'll talk to you next time.